Hey Divine Mommies, welcome to my channel. I am Crystal Divine Queen and this is my indigenous lifestyle. I help black women and mothers to create the birth experience that they truly desire, and I also support them with their postpartum adventures as well. I do all of this by providing doula services and using this YouTube channel along with ebooks and blogs and packages from my website myindigenousLifestyle.com. And I also provide affirmations and tips on my Instagram page too. But enough about me. Today I came to share with you some very interesting news, okay? So, did you know or are you aware that there are different types of epidurals? Who knew? I certainly didn't know. Epidurals are like the most popular form of pain relief when you go to give birth in a hospital. But there are several different ways to administer an epidural. The epidural comes with pros and cons, but who knew that there are different kinds of epidurals that you could choose from? It all depends on why the epidural is needed, the preferences of the anesthesiologist who administers the epidural. But did you know that a hospital's policy can influence the decision as well? I didn't know that. And of course the mother has influence on the decision too, but if we don't even know that we have choices, then that means we have zero influence on the decision of what type of epidural they are going to administer to us in our bodies. So that's what I'm talking about in this video today. Let's get right into it, the different types of epidurals. Now, an epidural is a type of anesthesia used to provide pain relief during labor and delivery, and it blocks pain from a specific region of the body. It leads to a total lack of feeling by blocking the nerve impulses from the back. And it's supposed to allow you to feel comfortable and still be alert during your birth experiences and allow you to be able to push when that time comes but not feel pain. And if you do feel pain, you shouldn't feel much pain at all. Now, that is not how my experience went, but I'm going to get to that in a minute. Let me just explain to you how the epidural is administered. The anesthesia is injected near the bottom of the spine only by the anesthesiologist. Now, if you're going to get the epidural, they're going to ask you to arch your back and remain very still while you're either laying on your side or you're sitting up. And it's very vital that you remain still and you hold your position, okay, because that prevents problems from occurring. And it also has to do with the effectiveness of the epidural as well. An antiseptic solution will be used to wipe down the area of your mid-back to minimize the chances of infection. Then, on a small area of your back, you will be injected with a local anesthetic to numb it. A needle is then inserted to numb the area, and then either a small tube or a catheter goes through the needle, and once it is into the epidural space, the needle is then removed. This is done very carefully so that it leaves the catheter in place so that you are able to get the medicine. You'll be able to get the medicine through periodic injections or continuous infusions, and then the catheter will be taped onto your lower back to avoid it from slipping out. So that is how it's administered. Now, there are three terms that are used interchangeably in the medical field. So there is regional anesthesia, spinal block, and epidural block, okay? So let me break down what each of those are. Regional anesthesia makes a certain part of the body numb and allows it relief from pain so that a surgical procedure can be done without the person being unconscious. A spinal block is a single anesthetic medication with only one opportunity to be delivered. And an epidural block is when a catheter sits in the epidural space so that medications can be administered as needed. An epidural block can be made to last longer than a spinal block as well. Now, I feel like that I got a spinal block. Even though the word epidural was tossed around, both times that I got an epidural, it was a single injection. There was never a catheter in my back, and I don't remember them taping anything to my back, let alone removing it once everything was all said and done. According to my research, it seems that every time an epidural is used, there is a catheter and a tube along with the needle. So those things tend to take place when you get an epidural, but a spinal block is something different. And I also want to say that when I broke my kneecap and I had surgery, I remember the anesthesiologist coming to talk to me to give me a block. And he didn't call it a spinal block, obviously, because he was injecting it into my knee, but it was a block nonetheless, and it was a single injection, and it just numbed that particular region of my body. So that just makes me feel like I had a spinal block even more. Now, let's get into the different types of epidurals. You have a standard epidural, and then you have a combined spinal epidural, okay? There are subtle differences in the two, and that has to do with the placement of the catheter. I'm going to refer to a combined spinal epidural as a CSE, okay? So when you get a CSE, it comes into contact with the fluid that surrounds the spinal cord. A standard epidural does not come into contact with the spinal fluid. It stops just outside the dura. And if you don't know what a dura is, it is the thick membrane that surrounds the brain and the spinal cord. A standard epidural is often referred to as a classic or a regular or even a local anesthesia epidural. A standard epidural uses different types of anesthesia medicine, and I'm going to have them listed on the side for you as well, different kind of anesthesias that they typically will use. But a standard epidural is very effective. It offers full pain relief, and it will obviously limit your ability to be mobile. So when you get this type of epidural, you're going to probably be confined to the bed. You also probably will not be able to feel your contractions when it is time to push. So if you are hooked up to the electronic fetal monitoring machine, then you will probably have to use that to know when you're having a contraction, so you'll know when to push. Now, a CSE is often an initial dose of a narcotic or anesthetic, or sometimes a combination of both. But you're supposed to get a lower dosage of medicine, and this allows you to have more mobility, to be a little more alert and feel your contractions when it's time to push, but not necessarily feel any pain. And it's often referred to as a walking epidural, which is something I've never heard of before. But there's something out there called a walking epidural, and that is the combined spinal epidural. But depending on where you give birth, the hospitals may not even permit you to get up and walk around because, you don't know how your body is going to react to it, and there is a chance that you'll be too numb to be able to walk around or stand up on your own 2 feet. And if you fall, that could create lawsuits for the hospital as well. So this walking epidural is pretty much so that you'll still be able to be mobile and move around in the bed. Now, there's also something called a walking spinal epidural, and this is kind of like new technology. It's not really an epidural, but a spinal analgesia. You get a small amount of narcotic injected into the spinal fluid, and again, it kind of works the same way. You get a little bit of pain relief, and you're also supposed to be able to still have some type of movement. The next one is a patient-controlled epidural anesthesia. And if you have had a baby kind of like back in the day, then you might be familiar with this, or maybe you heard your mom talk about this. But it's the epidural that they give you the button, where you're able to press the button and get a controlled amount of anesthesia to help relieve you from the pain. Now, this one, I don't know if I would ask for this. I'm pretty sure that you're still able to request this if you would like to talk to your doctor about it beforehand. I have my worries about it because I know that when you are in the midst of labor and you are going through these contractions and they're getting intense and they're coming closer and closer together, you're going to be more prone to go crazy on that button and press and press and press. Even though it says it's a controlled amount, you just never know. It's kind of like a risk that you might not want to take. And whenever you're having a medicated birth, you have to be aware that you are not getting this medication alone. Your baby is getting this medication, and you are a full-grown adult. The medicine will wear off for you a lot quicker than it will for a teeny tiny infant that was just born into this world. Sometimes they stay under the influence of medicine for days. So always keep that in mind if you're going to consent, that your baby will still be under the influence of the medicine, and it can affect you in your afterbirth experience. It can affect you with breastfeeding. The baby might not want to latch on properly because the baby is under the influence of drugs. So just keep that in mind, okay? Now, the last epidural that I found is also a new technology, and it's called the Program Intermittent Epidural Bolus. This is new technology, as I've said, and I wasn't really able to get a clear, concise description of what exactly the difference is with this epidural, but it's supposed to be a new superior method for delivering analgesia, and this method allows you to be able to have a wider amount of epidural space to administer the medicine. This video isn't that very long. There's so many different names for different types of epidurals out there that it can kind of get very confusing very fast. So make sure that you talk to your doctor ahead of time about the different type of epidurals. Make sure you thoroughly ask the nurses about the epidural as well if you're going to consent to one. And just know that, you have a voice, you have an influence on the type of epidural that you're going to receive. So just be aware that there's more than one type, and know that there are epidurals out there that will allow you to still be able to feel your contractions and just be comfortable and alert and just minimize the pain a little bit when you are in the midst of your birth experience. Okay, so thank you guys so much for tuning into my video. I hope that this was informational for you and you learned something, and I'm sure that if you browse my channel you'll find more videos that resonate with you. And just don't forget to like, comment, and share, subscribe to my channel, hit the bell, you know, all that good stuff. Okay, and I will see you guys on my next video. Peace.